Hi, I'm here today with Dr. Andrew Mueller, an oral surgeon from the Marquis Dental Implant Center. Our topic today is to talk about full arch dental implants. All right, so for patients who are out there, they're doing their research now. They're looking to try to find out what their best option for a doctor is going to be. What kind of questions should they be asking? What's most important for them to know as they're making a decision?
Sure. I think it's the same kind of questions you would ask when you're making any big purchase. How experienced is the person that you're going to use? What kind of materials are they using? The quality, of what they're using the materials. And then third, what's the warranty? What's my recourse if something doesn't go the way I expect? And so, the first one with experience, maybe the doctor has been placing implants for 20 years, but if they only place 10 implants a year, they're not really that experienced. Or how many full arch cases have they done? Maybe another doctor has been doing this for only 5 years, but they place 1,000 implants a year and they do over 100 arches a year. That's a lot more experience than somebody that does this pretty much every day. And also, what's their complication rate? What's their success rate? Those are really important questions regarding experience. The second one is the materials. So the quality of the materials, which materials they're choosing. And when it comes to full arch dental treatment, the materials are really important. They've changed a lot, and a lot of the materials that are commonly used still are very outdated. Some of the newer materials require a little more expertise. They're a little harder to work with, but they're definitely significantly better for the patient. And so making sure that, as of today, they're using something like zirconia or a nano ceramic, I think is very important. And then the third question is regarding your recourse, the long-term, the maintenance, and I would want to know if they have a warranty, how long does that warranty last, what does it cover, what does my maintenance look like, how often am I going to see you after I have this done, and then also, are you going to be around 10 years from now, 20 years from now, because this is a big investment and you want to make sure that you're going to be able to partner with a doctor or center that's going to be able to take care of you, not only today.
All right, that makes sense. So when we're asking these questions, things we should keep in mind are the experience, the materials and the components that things are made of, and the warranty or the recourse, and what we're going to be able to do in years to come. Thanks so much for your time and for giving us all this information.
You're welcome.